Hi everybody, I'm Crystal Haynes, and tonight on Greater Boston, new research shows just how dangerous giving birth can be for Black mothers and their infants. We'll take a look at the disparities and what we can do to fix them. Then, Mayor Wu officially files her plan to stabilize rent prices in the city. We'll hear from both sides of the issue on rent control. For years, the maternal mortality rate in the U.S. has far exceeded that of other high-income countries. And at last count, it was more than 3 times higher than nearly all of its peer countries, with nearly 24 deaths for every 100,000 live births. And that is just the average. The mortality rate is a whole lot higher for Black women here in the U.S. They are dying at more than twice the rate, with 55 deaths per 100,000 live births. And while other demographics can also factor into maternal and infant health, new research published by the National Bureau of Economic Research has found that Black mothers and their babies have the worst childbirth outcomes, regardless of poverty level, parental income, and socioeconomic status. In fact, researchers explain, quote, infant and maternal health in Black families at the top of the income distribution is markedly worse than that of white families at the bottom of the income distribution. Well, we're going to break it down, and I'm joined by State Senator Liz Miranda and Colette Dieujuste. She is the Dean of Nursing at Wheaton College, who's worked as a labor and delivery nurse and is a member of the National Association of Women's Health, Obstetric, and Neonatal Nursing. Welcome.
Thank you. Welcome.
So, you know, I think we've been having this conversation for many years, at least in the last 5 years, about maternal outcomes for Black and brown women. But now we're seeing that their babies are not faring as well. And Senator Miranda, we've been talking about this for this long. Tell me what you think about or make of these new numbers that have come out of this particular study when we're talking about babies.
First, it's an honor to be here with you and making sure that we're having this conversation, because conversations are really what have led Massachusetts in leading in addressing the maternal and infant mortality and morbidity crisis, not only in the country, but here in Massachusetts. When we first started talking about this issue, we had just filed and then passed within a year unanimously in the House and the Senate when I was a representative, the Maternal Inequities Commission, which met for a year, did listening sessions across the Commonwealth, had 95% percentage of support in that commission from Black and brown people with lived experience or providers. And what we learned from that, we filed a report in April of last year. And these numbers to us are not new. There's studies every year, every month that come out that basically say America is not doing well by Black and brown women and our children. I think the shocking piece of this study is that it shows that in normal cases, when you look at any social determinant of health, income, education, zip code, marital status, and education are usually factors. And what we found in this report from the Economic Bureau is that regardless of those factors, whether you're married, wealthy, college educated, live in a nice town or city, Black women are dying more and our babies are dying more or born with lower birth weight than the poorest of white women. And that is an alarm and a bell that I think is speaking to the fact that we must be urgent in what we're doing, not only in legislative arenas like the Massachusetts Senate, but what we're doing in community, in hospitals, in teaching institutions to reverse the tide.
And I want to point out some numbers from this particular report. And Colette, I want you to respond to this. We understand that the infant mortality deaths per 100,000 live births for the richest Black mothers versus the poorest white mothers. Richest Black mothers, 437. Poorest white mothers, 350, and that number actually goes up to 653 for the poorest Black mothers. Colette, do you see these numbers bearing out in labor and delivery rooms in your experience?
I think we have seen that, when we talk to Black women about their experiences, they've always feel that there is problem, that they are not being heard, that and it crossed the economic line, that women feel that they're not being heard, and that it's like they don't understand their own bodies. So when they are telling the healthcare providers that these are some of the things that are going on, they're not getting any result for them to be heard. So if women are not being heard about their issues and their problem, then that's going to lead to what we're seeing today, where we are seeing the increase in maternal morbidity and Black women dying. We're seeing that their children are not able to handle, and because of that, they born early. They have other issues that comes with it. So these babies are dying also. So it is really important that we pay attention to what is going on with the Black women that is happening. And some of the studies that are showing that we also have to take a look at the whole weathering effect that is pushing some of those things that are happening to Black women, so that we need to study them and try to see how we can decrease that rate. And we have to do it really, we cannot wait. And that is one of the studies that we're doing on birth equity, talking to these women and trying to hear what is it that they feel and what are the things that they think that could help them so that these things do not repeat with other women.
What do you think, Colette, in terms of educating nurses specifically? We also talk about physicians as well, but as the Dean of Nursing at Wheaton, I mean, what do you talk to your nurses about how to help a mother in that experience in the room with this equity lens, with this information, armed with this information that we have now collected data on?
Well, from some of our preliminary data that we're receiving from our study, some of the things that Black women are telling us is that we need to eliminate discrimination, racism, and we need to do it at the bedside. We need to make sure that women are being heard. The other things that women are telling us is that they need more Black providers. So more nurses, Black nurses to go into the field, to be nurses so that they can be able to help these women feel more comfortable, so that they can feel better about the care they are getting. We need more support groups to be able to help these women to make decisions and also to help them, to support them, because there is a lot of issue. It's not one thing with maternal morbidity. It is the comorbidities are very high, and there's all different things we need to do. Financial support is extremely important, that we need to try to find a way to support them financially, and try to help them to understand what's going on and teach them. So we have to teach our nurses all of these different things so that they themselves will be able to help champion those patients and help the patient find a voice so that they can talk about the problems they have and how they can get a result from them.
Senator Miranda, I know that a lot of the legislation has been focused on getting more diversity into the healthcare space itself. I know there's been a conversation about doula certification and having that extra support person in that healthcare space.
What's really interesting is I got into this work. I'm not a mom yet, because in 2017, my baby sister gave birth to a baby at 21 weeks that didn't survive. If it wasn't for a presentation by the March of Dimes, I would have never known what to call it. I was in a room with my sister who had complained the evening before about pain, and her doctor told her she was anxious and told her to take Tylenol and go to bed. And that morning, she gave birth to her daughter, Mila, 21 weeks, who did not survive. And so many of my friends and people that we know are going through the same things, because I'm glad you called it out. It's just racism. It's the structural, systemic racism that is in our healthcare system. It's also about access. It's about not looking at Black women's pain in the same ways we look at other women's pain. And women, particularly Black women and Indigenous women and women who are underdocumented, undocumented, live in rural communities or speak another language, are oftentimes not taken seriously when they're complaining about the birth experience. And so we need to reimagine the birth experience. And legislation is my wheelbarrow. That's the thing that I carry every day in my work. And I'm so proud that I filed this year a birth justice omnibus bill that I hope to bring many communities together from Pittsfield to P-Town to help me craft this bill. But also the Moms Matter bill and act is such an important one. It's around postpartum and perinatal mental health. All of us were probably watching our TVs, hearing about what happened in Duxbury a few years ago. In Roxbury, it happened again. And we are not taking the mental health of birthing people in this state seriously. And so I wanted to make sure that we know that we have a vehicle in policy and legislation, but it's so important that we're teaching nurses differently, we're teaching doctors differently, that we're putting more budgetary sort of support for peer support groups, for groups to handle many birthing people are going through miscarriages or stillbirths. Many of them suffer from preeclampsia and sepsis and some other of the comorbidities of diabetes and hypertension that is impacting Black women. I just want to say one more thing, is that we need to do everything. This is an and to get to greater equity and justice so that no Black woman is dying in the Commonwealth of Massachusetts and then our babies have a fighting chance. We have to do everything together. And so I just want to encourage folks who are watching the broadcast thinking like, well, what can I do? At every level of government, in every sector, beyond healthcare, we have to do better by birthing people here in the Commonwealth of Massachusetts.
Colette, I was interested about the point you were making about how the funding to get people that look like the people who are birthing in these spaces, making sure that they look like those folks. How important is that piece versus the money it seems like hospital systems are spending on implicit bias training and other things like that? And Senator Miranda mentioned it's not a this or that, it's everything all together. But it has to be that we've been talking about this for many years. It has to be more than just the training of the folks in the space. There has to be another level. And what do you see as that another level as someone who's been in the labor and delivery room?
I mean, it's important to do that training because that training will help and will sensitize the people who are working in the space so that they make sure that they understand the patients that they have. But we started in the nursing schools with our students, trying to make sure they understand, social justice and understand that the global health that people are living in and how they need to be able to help the patient find their voices and be able to help the patient explain what is happening. At the same time, we need more nurses, more Black nurses, to be in that space. And that we need to be able to do since really elementary school. We need to encourage these Black girls and Black boys that nursing is a great profession, that we're a caring profession who love people and want to show the best of whom they are, that, we use our critical thinking skills and to make sure that we understand what is happening and to be able to take care of the patient in all the ways that need to be done. So I think it's both. We need to help the people that are here now to be able to do that, but we also need to bring new people in. And that need to start since elementary school to show how wonderful it is to be a nurse and how compassionate and caring that we are and how that we can use that to be able to help people wherever they are and then lose our biases so that when students then they become nurses, then they'll be able to take care of our patient. Our patient will be able to see that the nurses that are in there look like them, act like them, to be able to feel more comfortable. Because some of the things that they ask for is to eliminate those professional, the behaviors that is happening. They want that to go away,
right,
so that their voices will be heard and they'll be better be taken care of.
All right, well, we're going to have to leave the conversation there. We certainly could be talking about this for hours now. Senator Elizabeth Miranda and Colette Dieujuste, thank you so much for your time.
Thank you very much.
Mayor Michelle Wu made good on a centerpiece of her campaign yesterday, officially filing her rent control proposal with the Boston City Council. Now, her plan would link rent to the economy, capping annual increases based on inflation and setting a maximum hike of 10%, with exceptions for newer buildings and small owner-occupied properties. It's an effort to slow down ever-increasing rent hikes in Boston, which beat out San Francisco as the second most expensive city in the country for renters last year, falling behind New York. But the City Council is just the first hurdle Wu's plan will need to clear, because Massachusetts voters banned rent control statewide a couple of decades back. The proposal will need to clear the state legislature too before it can actually take effect. And we know that that will be no easy job. Several other cities have tried to pass similar rent control bills in recent years. None of them have passed. But will this time be different? And should it be? So we're going to get into this debate. I'm joined by Mike Leyba, the co-executive director of City Life Vida Urbana, a community organization working for racial, social, and economic equality in Boston. And of course, we're also here with Doug Quattrochi. He is the executive director of Mass Landlords Incorporated and the co-founder of Renter Helper Incorporated. Welcome, gentlemen.
Thanks for having us.
So let me start with you, Mike. I know that a lot of folks in your space, in the housing equity space, the renter space, have said that this isn't quite rent control and it doesn't go far enough. What do you think about this proposal?
Well, it's worth saying, let's take a step back here. The mayor choosing to propose this policy to the city council is itself a huge point of celebration. We have been working to bring back rent control for over 30 years. And since it was repealed in 1994, we've been really trying to build the groundwork and lay the infrastructure and sway the public opinion that this is the right choice for Bostonians. So the fact that we actually are at this place and have a proposal and it's concrete is itself an achievement. So we should be celebrating that today and sitting with that today. But that said, yeah, of course, there are some things that I would, if it were up to me, if I were the mayor, I would strengthen it. There are just a couple of small points that we feel like can really tighten up this policy overall.
What are some of those points?
Oh, to start off, you mentioned the cap on rent increases. So the mayor's proposal is CPI, a measure of inflation, plus 6%. In other words, rent can go up 6% any given year, plus the amount of inflation. So it's already starting from this place of it is inevitable that rent will go up year after year, up to 6%, even before we take into account how costs are rising. People in Massachusetts today, last year, and in the past years, they're struggling to make ends meet. And so any step above inflation is already going to cause severe economic strain on people who are trying to make ends meet.
Well, Doug, let's talk about the effect on landlords. What kind of impact will it have on them?
Well, sure. As they say, the devil's in the details. And I think the first most important detail to look at is that exemption for properties built within the most recent 15 years, because that's actually nowhere in the proposal that the mayor sent to the city council yesterday. There's a couple of paragraphs that say we can make additional regulations, and I assume that's where the exemption for newly built properties comes in, but that's not actually in the proposal. And so when you look at the other small print, it says we have the ability to establish a board that would oversee rents and establish a fair rate of return. So that basically takes the cap that looks kind of reasonable because it's kind of tied to inflation and throws it out the window and says, well, if we decide, we can say a landlord's not allowed to raise the rent at all because they're already making too much money. And that doesn't recognize rising costs of real estate, professional services like plumbing, real estate tax is what I meant to say there, insurance costs. It's just housing isn't free and there's a whole lot of expense to it. And nobody's talking talking about cost control in any way. So landlords are really apprehensive about this proposal, and because it's nothing like the Oregon system, which is pretty cut and dry, here's the inflation, here's how much you can raise the rent, there are no rent control boards, it's really unclear how this is going to play out.
That said, historically, though, it seems like the legislation that's in place, especially since '94, has been in favor of landlords in that we have no fault eviction that's in place. We repealed rent control. So historically, if you look at the way that legislation or any bans or lack of exists, technically landlords could expect that these proposals would stand as they are being discussed.
Well, especially the so-called prohibition on rent control, because Chapter 40P actually allows you to have rent control. So Mayor Wu could have rent control at the next city council meeting if she wanted, just by enacting Chapter 40P, which says you can enact any kind of rent control scheme you want as long as you reimburse owners for the difference between the controlled rent and the market rent. So to your point, Mike, we could have an absolute cap on rent increases at 0%, but as housing costs continue to rise, Boston would have to reimburse owners for that. And that's not particularly owner-friendly. It's just economics-driven because housing costs continue to increase. And so it turns rent control into kind of rental assistance. That's a pretty reasonable thing. And that would really, in our view, help because the mayor would be funding a kind of a new rental assistance. But instead, we have this entirely different thing with rent control boards. We're trying to work around 40P, which is pretty reasonable. So from our perspective, there are lots of options out there, and they're mostly like rental assistance.
Do you think, I mean, we're looking at record level of rent, Mike, and folks really, I mean, San Francisco, when you read this number, I don't know that a lot of folks thought Boston were going to be able to surpass San Francisco in some of this information and some of this data that we've been keeping. Do you think that this will be enough to get folks back into their apartments or to stay in their neighborhoods?
I don't know what people expected would happen. You know, after years of deregulation and letting the industry do exactly what the industry wants to do, this is where we are. It's not, you know, it's not magic. It's not something that's an imaginary idea. It's just this is the way the market works, right? It's interesting that that we're talking about reimbursing, you know, landlord profit. That's kind of an interesting perspective, I have to say. I disagree with the notion that the mayor could automatically do that with the city council tomorrow. That's not, you know, I don't think that's accurate.
It is the law.
Well, let's not create another landlord subsidy. That's probably a bad idea. Either way, we think that most people that live in Boston, most working class people, they are struggling, right? Inflation is high. Rent is high, the cost of living here, education, even gas costs, you know, electric costs right now, eggs, everything is getting more expensive. We have to draw the line somewhere. And the place that we draw the line is where we say, you should not take away access to this critical, life-saving, health maintaining need that people have. That's where we say the line is. You should not take away something that is somebody's ability to remain stably housed, to keep their kids in school, to remain a voter, to access their job and healthcare. This is the difference between housing and other commodities, right? There is a social benefit and a social use to having housing. Affordable housing is something that our city desperately needs. I find it interesting that the mayor's proposal, you know, it is actually pretty similar to the Oregon cap. And the Oregon cap is, it's being done for an entire state. There's rural areas, there's suburban areas, there's urban areas. We're talking specifically about Boston, which is one of those two most expensive places to live in the country. The other places have some form of rent stabilization already. New York, California has had it, New Jersey has it. And frankly, New Jersey has a scheme which allows for much stronger rent control than is being done almost anywhere else.
Also, Doug, I want to ask you this, because every time I tend to do a story about this or do any of the research, it seems like these large corporate owners, these mega buildings, these mega high-rises, have different rules than it seems like the small landlords do. And the impact is felt differently. But it seems like the legislation has to affect everyone in a similar way. Do you think that smaller landlords will be better protected under this WU legislation than they have been in the past?
No, I don't think so. I mean, on the face of it, it looks like it's intended to help small landlords because it says if you own or occupy a 6-unit building, you're exempted. But there's a large spectrum between a landlord who lives in the building across the street from their rental and the large interstate corporations that we're talking about that behave very different from a typical mom and pop landlord. There are lots of folks who provide housing in the city of Boston who are neighbors in the community. They're nearby, but they don't live in the building. They're not going to be exempted from rent control. And when you look at like a city like San Francisco or New York, which has these like nation leading high rents, they've had rent control for decades. And the reason their rents are so high despite rent control is because those rents measure kind of the unregulated market rents. When you have rent control in a system like in Boston, like we could have here, renters who get a rent controlled unit rationally stay as long as possible. If you have a complete rent control system, you can have tenancies stay 10 times longer than average, like 20 years on duration. So those apartments never come up for rent. And the ones that do, like the owner-occupied exempt, like I in my 3-decker here would be exempt if I were in Boston. I would be able to charge market rents. And so my rents go way up because all the other housing has been taken off the market. So there's just a lot of factors here, and small owners cover a large spectrum. It doesn't mean owner-occupy. It's really small landlords could just live across the street from it and they'd still be subject to rent control.
So in the last minute or so, Mike, I want to ask you, is this a reason to celebrate for, I guess, for renters, for the folks you work with, right? Or is it like, be like, maybe, you know, like...
Well, we're going to celebrate because it's a moment.
Yeah.
I would say that it's not inevitable that we win rent control in Boston or anywhere else in the state. I think the thing that we really need people to do is to make their voice known. Over half of Boston residents, Boston households, are renters. Over half of those renters are rent burden, or 47%, almost half. Our people need rent stabilization, we need rent control, and we need our people to tell their legislators that that's what we need. We need the strongest version of this policy to keep our people in our homes.
Doug, final word in the last 30 seconds we have.
Well, we agree that folks shouldn't get displaced if they can't afford the rent, and that's why Mass Landlords is suing the Department of Housing and Community Development over pandemic rental assistance, because that safety net failed a ton of people. So there should be a safety net. Rent control probably isn't the right way to go, but if there were a rent control scheme that were just like rental assistance, that would probably work, and that is allowed under Chapter 40P currently.
All right, we're going to have to leave the conversation there. Mike Leyba and Doug Quattrochi, thank you so much for your time.
Thank you both.
Thanks.
Well, that's it for tonight. Thank you so much for watching. I'm Crystal Haynes. Good night.
The ancient Amazon.